Well, in the United States during the last decade, there's been a great increase in scrutiny of operating room protocols and practices by our regulatory agencies. And a lot of the things that have come up are really not evidence-based. So in some cases, these guidelines came from general surgery guidelines, and in many cases, ophthalmology is different. So this was our attempt. It's a task force made up of representatives from 3 societies, ASCRS, AAO, and our Ophthalmic Outpatient Surgery Society. The task force was chaired by Nick Mamalis and myself, and this was our attempt to come up with more ophthalmology-specific guidelines for the cleaning and sterilization of ophthalmic surgical instruments. There's been a major push in general surgery to move away from what used to be called flash sterilization. They now call it immediate use steam sterilization. And what gets confusing then is a lot of what we do in ophthalmology for our same-day sequential cases is very similar. And so we've had to clarify that with the regulatory agencies. And just last month in ophthalmology, in the September issue, was our paper. Again, the task force subsidized a study done with a testing laboratory using phaco handpieces to verify that a short cycle where we interrupt the dry time and also basically don't necessarily use wrapped instruments for every cycle was in fact safe. And so I think this defends the practice of what is really done around the world in ambulatory surgery centers, which is in some cases to use instruments in a covered container but not necessarily wrapped, with shorter cycles of steam sterilization, where again it's allowed by the manufacturer's instructions for use, and in some cases they allow interruption of the dry time. You know, a lot of instrument instructions require or specify the use of enzyme, and in some of those cases the manufacturer is taking the worst case scenario of a heavily soiled instrument that you really need to use this detergent to clean off. The problem is that it's very hard to wash that off, and this was shown in one of the papers that we cite in our guidelines out of Moran. And if you have any bit of residue of enzyme on instruments, this is quite toxic to the anterior segment. It causes TAS, and we basically said that if you are rinsing and cleaning the instruments promptly, you don't really need enzyme, and you may actually be putting the patient more at risk to use it.